Hi, good morning. My name is Dr. Ashish Vashishth. I am Senior Consultant, ENT and Head and Neck Surgery at Manipal Hospitals, Dwarka, New Delhi. And today we shall be speaking about a very commonly known topic, it is sinusitis. We'll briefly divide this into causes, what it is, the symptoms as to how people may understand, and treatment algorithms including medical and surgical ones. Sinusitis normally is a misnomer and is often used interchangeably by patients when they mean nasal obstruction. Sometimes they mean headache, they might mean nasal discharge. All of these symptoms are often clubbed into a common terminology such as sinusitis. So all these are not same, they are merely symptoms and may or may not reflect sinusitis. So sinusitis in general, as the name suggests, is an itis, which means inflammation of the sinuses. Our sinuses are structures inside the skull bone which are joined to the nose, and they help us in ventilation, they help us in keeping our skull bone light, and they are situated below the eye, above the eye, and deep inside the brain. All these are joined to the nose and they help in ventilation and breathing. And when they get inflamed, which could be either one or all or some of them, we have a varied kind of presentation. The common symptoms of sinusitis could be nasal obstruction, blockage, which could be one-sided or both-sided. It could be headache, which could be mild in certain cases to very severe ones. Often above the eyebrows is a very common kind of headache in sinusitis. Patients may have nasal discharge, which could be watery and sometimes when there is more allergic, or it could be thick, profuse and blood-stained in certain instances. Patients may also complain of a vague pressure or pain over the cheeks, below the eyes, above the eyes, deep behind the eyes, and sometimes fatigue and non-specific symptoms such as inability to sleep well or lack of feeling fresh on waking up. Now all these symptoms are not to be clubbed together and they require a different modality of evaluation. We advise you to seek the help of a local ENT doctor wherever you may be to further investigate this issue. The most common ways we investigate sinusitis, whether or not you have it and how much is the affection, is basically through clinical examination, an endoscopy, which can be done in the outpatient, is a 5-minute procedure, and most importantly, a CT scan of your sinuses. A CT scan is a quick procedure, takes 5 to 10 minutes and can be extremely informative regarding the extent of sinusitis. Sinusitis, for the ease of management and for eventual outcomes, we divide into two basic categories. One is with polyps, the other is without polyps. Polyps are nothing but grape-like structures of your nose, which basically means that the mucosa of nose, the lining of nose, has swelled up profusely, leading to blockage of either the sinuses or the nose itself. When we are managing sinusitis without polyps, treatment could be either medical, which could be antibiotics for 2 weeks or more, some nasal sprays, some symptom-based management such as paracetamol for pain relief, and anti-allergics. If these treatments fail, one may or may not need surgical interventions, which also depend on what to be done based on the amount of sinuses involved. When it comes to sinusitis with polyps, like many patients would have been told by their doctors that they have polyps. Now polyps also is not just one kind of category, it could be many. Polyps in nose or sinuses could be because of allergy, could be because of asthma, could be because of fungal disorders, and could be because of other inflammatory disorders. All of them though may be helped with surgery, but the eventual outcomes and treatment protocols for them may vastly differ. Surgery plays a very vital role in the overall management of sinusitis patients, though it's not a one-off. It is not the end of all treatments, it is how we start treatment. The goal of surgery, or so-called endoscopic sinus surgery, where we go endoscopically inside your nose and sinuses and we open your sinuses up wide and clear, is to basically provide a gateway, first of all to clear all the diseased mucosa and polyps from your nose, and then to create a passage for nasal irrigation, for topical medicines like some sprays and drops to keep those areas clean and healthy. Some patients may require more than one surgery over their lifetime. That depends on what kind of disease or pathology we are looking at. All patients may not fit into one kind of category. It is also very important to have realistic expectations, discussions with your doctor who is operating you to know what kind of treatment protocols are there, how much follow-up would you require, because everybody's disease is not the same. We also come across many patients, they would say that somebody in their household, their families, their relatives had some kind of nasal surgery, and some of which would succeeded, some of which did not succeed, and hence they are scared to undergo a surgery. That does not bode well. Every patient, every surgery is different. The surgery was done with what indication, for what purpose, through what technology, all that matters a lot. So one kind of result cannot be extrapolated onto all patients. Rather than going into minute details, I would suggest that go for a checkup today. If you have been diagnosed with sinusitis, if you feel you have had these symptoms, get a thorough checkup, get a CT scan done under the guidance of an ENT surgeon, and seek for help, and help should be provided. Thank you.